topic is related to nursing delegation, delegating the task by the RN to LPN, LVN or UAP. LPN means licensed practical nurse, LVN means licensed vocational nurse, and UAP means unlicensed assistive personnel. So, the registered nurse is accountable for all the duties which she is delegating to LPN or UAP. What are the duties of registered nurse? The two duties performed by the registered nurse are, she is getting assignment of critical care patients. All critical care patients, registered nurse has to take care. Then any new admission in the department has to taken care by the registered nurse. Registered nurse has to give the discharge education. Comprehensive assessment has to do only by the registered nurse. All routes of medications, IV medications, therapeutic medications only done by the registered nurse. IV and chemo, blood transfusion, these things has to do by the registered nurse. Then blood transfusion procedures completely has to do by the registered nurse. Invasive procedures, central line and post assessments, all these things, arterial line, all these things has to do by the registered nurse. Developing the nursing care plan has to do by registered nurse. She has to use critical thinking to interpret the laboratory data and findings. Never delegate the task to the LPN or UAP if your patient is unstable. Unstable patient has to taken care by the registered nurse. We can say one mnemonic like TAPE. TAPE means T for teaching, A for assessment, P for planning and E for evaluation. So, the TAPE has to do only by the registered nurse. Teaching, assessment, planning and evaluation. TAPE. Just remember this. So, she can't delegate this TAPE to LPN or UAP. Clinical assessments, initial client education. First, client education has to give by the registered nurse and discharge education also has to given by the registered nurse. Clinical judgments, blood transfusion, all these things, all critical care works has to do by the registered nurse. These are the duties of the introducing the all new Nursing Manthra NCLEX series, which contains study materials and video crash course, specifically designed for easy access and most convenient method of study. The series has been divided into 5 main parts. Question bank, rationale followed by each question, the explanatory video collections with the help of illustrations and animations, exam handbook, and finally we have the mock test and cheat sheets. Select your package now and get started. For more information about the subscription plans, you can contact Nursing Manthra WhatsApp